This is Dainila Hospital on the outskirts of Mogadishu. Until recently, it was the only hospital that offered free medical treatment in the capital. It's now operating at less than half its capacity.
We haven't paid workers in 4 months. We have no money. We've closed sections of the hospital, including the surgical theater. I'm afraid we might soon have to close the entire hospital.
With no meaningful government support, hospitals in Somalia are almost entirely dependent on donor funding. But that funding has fallen by nearly 2/3 to $29 million in 2015, from $72 million in 2011. Medical workers here doubt whether they can continue to provide help to some of Somalia's poorest people due to the declining funding for their services. Until 2013, much of Somalia's health needs were provided for by the agency Doctors Without Borders. It left the country in protest after some of its staff were killed and the men convicted for the crime released by the government. Other agencies are struggling to fill the gap.
Our activities have been adversely affected, especially in terms of providing supplies. Medical supplies, which is one of the key things that we do here, has been very limited due to the funding issue. And also staff motivation. If the staff cannot be paid their salaries, their ability to work becomes greatly hampered.
More and more patients are now turning to the new Adow hospital in Mogadishu. The state-of-the-art hospital was paid for by the Turkish government, which has also committed $86 million to run it for the first 5 years. Medical workers here say they are overwhelmed.
Our biggest concern is that we don't have the capacity to serve the big numbers of patients that we are getting. Our doctors are from Turkey, and we have no means to bring in more.
For many Somalis, there is no end in sight to the health crisis. They know only too well that the impact of the nearly 30-year-old conflict in their country is now competing for attention with new ones across the world. Mohammed, Adow, Jazeera, Mogadishu, Somalia.